Dogs are man's best friend, which is understood considering we spent many years selecting the most companionable wolves to form the golden retrievers and Maltesers we love today. With that breeding came an attachment between the dog and his human, each wanting to spend as much time with each other as possible. However, how much time is too much, and how much attachment is too much? Separation anxiety is a horrible and sad reality that many dog owners and potential dog owners are faced with yet very unaware of. Separation anxiety is classified as a behavioral disorder that shows physical, physiological, or behavioral signs of distress when in the absence of the dog's person or people, or when they cannot get to their people. Now, separation anxiety can show itself in many ways, such as destruction, vocalization, self-inflicted injury, excessive salivating, pacing, urination, defecation, freezing or immobility, withdrawal, problems with cognitive behavior, trembling, and sweating paws. Now, let's start with some facts versus fiction surrounding separation anxiety in dogs and what you can do to prevent it. Firstly, no breed, age, or gender will be more predisposed to having or developing separation anxiety. According to the American Veterinary Medical Association study, Separation Anxiety Syndrome in Dogs and Cats, dogs can develop anxiety at any point in their life. However, some geriatric dogs may form an anxious attachment to their owners when suffering from physical ailments. Slight separation anxiety is normal for puppies when you first get them, around the ages of 6 to 12 weeks. This is because they were moved from their litter and placed in a new home, and they need time to get used to being with their owners, being by themselves. However, any distress that these puppies may experience is short-lived, not long-lasting, not intense, and will diminish over time as the dog forms a schedule. Separation anxiety is a more extreme version of this, and it will only go away with serious treatment and attention to the dog's problems. Oftentimes, dogs with separation anxiety ignore the cues of other dogs to play, they don't use food toys, they don't eat food, and they will physically injure themselves in order to escape before seeking somebody to spend time with. Exercise, while it is helpful and is important for your dog's health, is not a final solution to your dog's separation anxiety. According to Dr. Patricia McConnell, a zoologist, she says it's unclear why some puppies may be more prone to developing separation anxiety than others, and despite your best efforts, it's not always preventable. The Tufts Animal Behavior Clinic states that the goal of treatment when it comes to separation anxiety is to resolve the dog's underlying anxiety by teaching him to enjoy, or at least tolerate, being left alone. Identifying whether your dog has separation anxiety or not can be difficult. As stated before, it shows itself in many ways, such as urination, excessive salivating, destruction, injury, and so on. And sometimes it only happens when one person leaves, and not everyone. So if you're that person, it can be twice as hard. Now, some great ways to see whether or not your dog is acting differently when home or away is to video it. A good place to video is from your front door and where the dog is usually relaxed while you're around. It's also good to video when you're home and the dog is behaving while you're there so that you can compare the video while you're away and the video while you're home. Sometimes dogs with separation anxiety will be normal when the owner is around and even leave the room, although in other times they'll be Velcro dogs when you're home. This first photo shows a hole in Soren's face from him scratching. Now, his anxiety is in response to his family member leaving for college, moving to a new home, and a new puppy being introduced. In these next photos, you can see a lot of bald spots on Soren's stomach and legs. This is from where he bit and licked off his hair. In a way to combat this, my aunt used a pheromone plug-in and a pheromone collar, and it's helped tremendously, as you can see some hair growth in this last photo. Gimli's anxiety started when her eldest son was a senior and out and about a lot, gearing off to head off to his first year at college. First, it started off with just some light scratching at the door handle, and initially they thought it was just noises or vehicles outside that were upsetting him. Then, they realized during a storm that he was trying to get outside because the lightning was freaking him out. As time went on, the damage to the doors and walls, as pictured, just became worse. He was always trying to get out of the house, and every time the mom would leave the house, even if only for half an hour, she would come back to a sopping wet door handle. He could not handle being home without a human. You want to be proactive for treatments. 1. If you're buying a dog, make sure it's at least 8 weeks old. Those first 8 weeks of their life are crucial to encourage learning and safety and interaction with their litter mates and mother. If your dog is older and has not yet developed separation anxiety, make sure you video them twice a year when you're not home. This provides a comparative video for when your dog is around and when your dog is not. Now, my dog has separation anxiety. How can I help them? 1. Provide a calm environment and do not reward anxious behaviors. I know it's difficult when they're whining or nudging you, you just want to pet them, but petting them shows that it's okay for them to do this. 2. Talk to your veterinarian. Outside of you, your vet knows your dog best, and they'll be able to give you the best path forward if your dog is showing signs of separation anxiety. 3. Your dog's diagnosed. What do I do now? Do not leave for long periods of time. This shows that while you're treating them, it can have major setbacks if you disappear and they feel like they're being abandoned again. 2. Teach your dog to relax. Cues such as sit, down, stay, relax, and focus allow them a stability and the ability to say, okay, I'm fine. And 3. Medication. Medication is important, even in not so severe cases. Behavior modification is good, but it takes a long time. If you do all 3 of these, improvement should show in 6 to 8 weeks. Now, it's important that if you do have to leave, you hire a pet sitter or someone to stay with your dog while you're gone. Signs of anticipation are also a big part. Your dog begins to anticipate when you leave, and they hate every second of it. They take these things such as departure cues, such as you give them a specific treat or a specific toy when you're going to leave, or you get your keys or you do your makeup. Now, these are all very indicative and can lead your dog to have extreme anxiety towards your departure. It's important that you look for signs of anticipation, such as a wrinkled forehead, tight facial muscles, a tail tucked between the legs, or them watching you closely and following you as you go to leave the room. Greetings and exits are incredibly important. When greeting your dog, make sure that you greet them calmly when he is relaxed and quiet. You want to ignore any frantic behavior that they use to greet you because that's just rewarding the excitement. When you're leaving, you want to leave quickly, quietly, and calmly, but that doesn't mean to do all of your leaving procedures as you normally would. If you're packing something, pack it a couple hours before, so that way your dog starts to unlearn the behavior of you grabbing your keys means that you're going to leave them for a long period of time. Next, you want to make sure that you're providing puzzles and games for your dog to keep busy with. A busy dog is a happy dog. Although, make sure that you set these out during other times as well, so that they don't associate these with your departure. Take your time. Do not try and rush your dog's treatment. Rushing can lead to major setbacks. It's important that you read your dog's cues and you pay attention to them. They're telling you what they need.